So, are there any specific risk factors?
Yes, there are risk factors involved. It's a very, very important message that I would like to give. After the age of 40, once a year, a visit to your eye specialist is very, very important.
The message is loud and clear. Okay, right information, right time. We have now
Yes.
the treatments available. So, please consult at the right time.
Yeah.
Namaste. Welcome to Arogya Mitra podcast, your trusted companion in healthcare insights and expert advice. Today, we bring you a topic which will help you to see the future clearly. See future clearly and insight into the common eye problems for elderly. Join us as we discuss the risk, symptoms, and the latest advancement in the eye problems for the aged. Let's welcome our today's expert panelist, Dr. Shilpa Kodkany, a well-known name ophthalmologist from Belgaum. Welcome, Dr. Shilpa.
Thank you so much, Varsha.
So let's get started.
Yes.
Let's start from the most common one. So we all know that as we age, there are certain changes in our eyes and the vision. So what is this AMD and what all comes in that?
Okay. There are many changes that occur, like you said. One of the problems that we see in the elderly is what is called as age-related macular degeneration, in short called AMD. Now, to explain to you as to what exactly is the macula and what exactly is degeneration, I would like to show you the eye per se.
Yeah.
So, this is the eye. When you look at a cross section like this is the front part which is called the cornea.
Okay.
This is the lens here, and this whole thing is the eyeball. And from the inner side, there is a layer which is called as the retina.
Okay.
And on this retina, there are blood vessels, as you can see here. And this particular spot is where all the vision that comes from the front here gets focused on this portion, which is called as the macula.
Okay.
So
Just a
whatever
spot.
light comes into our eye
Mhm.
first goes on the cornea, that is the front portion, then the lens, and then on this portion the macula, and from here it goes through this nerve which is called as the optic nerve into the brain, and that is how we process the information which has gone into our eyes, and we understand things and we can see things properly. Now with age, what is happening is this particular macula starts getting degenerated.
Okay.
Just like our skin gets a little loosened up, we get wrinkles on our faces with age. Similarly, all the tissues of our body start getting a little degenerated as per age. Why particularly the macula and not rest of the retina is because, as you can see here, the retina is thinned out.
Okay.
There's a like a concave
Curvy,
depression. So this retina is thinned out here, and that is why it is more prone to degeneration. And that is why age-related macular degeneration, that's how it affects that particular portion
Okay.
of the macula. So it is the portion where all the vision is getting concentrated. So imagine if that particular area starts getting degenerated, there is a decrease in vision.
It is
And
the
the
spot for the whole activity of the vision.
yes, so it's exactly the spot where all the visual impulses come and get concentrated. So that's why the degeneration affects central vision.
Okay.
So a person who has a macular degeneration very often comes to us with a complaint that when I'm looking at your face,
Hmm.
I cannot see your eyes and nose, but I can see your ears.
Okay. They can see the outline.
Yes, they can see the peripheral part of it,
Mhm.
they can't see the center.
Okay.
So that is what is macular degeneration,
Mhm.
and that's how it affects people.
Okay.
Some people are able to tell us this thing of central vision. Some people just come and tell us that we just can't see very clearly.
Mm-hmm.
So,
So it can present differently. So are there any types of it?
yes, there are basically two different types of degeneration. One is what is called as a dry AMD, and the second is what is called as a wet AMD. Now, dry AMD is something where, like I told you, those cells in the macula, they start getting a little degenerated, and those areas are called as drusen, what we call as drusen.
Okay.
So, the impulses do not go through very well.
Mm-hmm.
And a dry AMD, it takes a long process for the vision to slowly and gradually drop.
Okay.
Okay, so that is one type.
Mm-hmm.
The second type being wet AMD, here there is an actual swelling up of the macula.
Mm-hmm.
That means the retinal tissues, they swell up
Okay.
because there is fluid accumulation there.
Mm.
There is fluid which accumulates, and that is why it swells up.
Okay.
And when it swells up, most often these people, these patients come to us with almost like a sudden loss.
Okay. So that is
That
a
I
acute
was
kind of.
seeing very well till a few days back, suddenly it has started deteriorating.
And fast? Is it
And
very
it
fast?
can happen fast. It
Okay.
can happen fast. So that is one symptom that we have seen in, and most often the dry type, we diagnose it when a patient comes to us for just a routine checkup, or maybe for they come saying maybe my spectacle number has changed, that's
Mm-hmm.
why I have come. So most often we diagnose it at that time, and the vision loss is not so very
Acute.
significant.
Mm.
It is significant, but it's not so bad, you can say.
Mm-hmm.
But in the wet AMD, the vision can drop to a large extent, means sometimes even causing blindness.
Okay.
So this is one important thing where a dry AMD can convert into a wet AMD when there is a swelling, and the swelling occurs because there are new blood vessels which form there,
Okay.
and those new blood vessels are weak, so they leak out fluid,
Mm-hmm.
and that's how there is
A
that
swelling.
fluid
Mm-hmm.
accumulation there.
Mm-hmm. So, as we were discussing, the dry is little subtle, the wet is little more dangerous or acute. So, are there any specific risk factors?
Yes, there are risk factors involved. Of course, like I said, one is age itself is a risk factor. The other thing being that it is seen that there is a slightly larger predomination of women being more affected than men.
Okay.
The exact reason is not known, but to some extent it's also because of dietary restrictions if you're following. So maybe that's the reason why women are more affected than
Like
men.
weight loss and
Yes,
everything,
because women do a lot of like crash diets and all
and
that. Not
specifically
that
at
men
that
don't.
age.
Yeah, not that men don't, but it's mainly seen among women. So there's a slight preponderance of women as compared to men. And also diets. Uh, like for example, when I was studying my ophthalmology, age-related macular degenerations were hardly seen at that time in our populations.
Okay.
We had read a lot about it in the Western world, and most often these dietary changes that we see are because I have also always maintained this, that our Indian diet is a very balanced diet.
Mm-hmm.
Our chapatis or jawar ki roti, vegetables and rice, your dal, your pulses like usal,
Mm-hmm.
these things are a wholesome diet. So we have seen that age-related degenerations are much more commonly seen today as compared to the past.
Okay.
Whereas in the Western world, it was quite predominant. But
So
today
diet
it is
is one of
almost the
the
same. Yes, it
major
is.
and
It
the
is.
change in diet what we are following nowadays.
Yes, especially we don't eat so many things because we feel we are putting on weight, we feel all those things, and nothing wrong. We should not put on weight, but eating the right kind of food. We have to eat the right amount of protein, less amount of fat, carbohydrates to some extent. So these are some things that need to be followed. Other risk factors are also smoking, um, excessive alcohol. One of the reasons again is excessive alcohol. Your food intake is obviously reduced.
Yeah,
So
that can lead to
that can
deficiencies
lead
and
to
it can trigger it.
deficiencies. Yes. So vitamin deficiencies and antioxidants.
Lack of
Yeah. See,
antioxidants,
like now, even our regular diet, like our Indian diet, we always have some raw vegetables like tomato,
koshimbir and
koshimbir, what we call, kakadi,
the
tomato,
salad part of
the
it.
salad part of it. They are very high in antioxidants. And in fact, when we see patients with macular degeneration, one of the treatments that we give is antioxidant capsules,
Okay.
like lutein, zeaxanthin, bilberry extracts. These are all incorporated in that tablet, which we give once a day to our patients. So it is a part of our treatment regime.
Mhm.
So if we are eating natural antioxidants, it is definitely going to delay or prevent macular degeneration.
So we have talked about the risk factors, but as you were saying, especially about the wet AMD, that it can suddenly lead to
Yes.
loss of vision. So are there any
Or
warning
even,
signs?
yes, or even may not be complete loss, but a significant decrease in vision
Mhm.
is what we see in patients with wet AMD.
So are there any warning signs which should indicate that I should consult a ophthalmologist immediately?
The warning sign itself is a decrease in vision.
Mhm.
What I would say is, I would advise people, when you have even a slightest doubt of some disturbance in your vision, you must consult the ophthalmologist immediately. Most often, our patients give it time, thinking that it's a spectacle issue, probably I'll go when I have the time.
Right.
So that doesn't help, because
Mhm.
the earlier you reach the hospital, the earlier it is diagnosed, the earlier we treat, the chances of regaining vision are better. So today we have what are called as anti-VEGF injections.
Okay.
VEGF means vascular endothelial growth factor.
Mhm.
Like I told you, there are new blood vessels which are formed, which
Hmm.
are leaking.
Hmm.
That is causing the swelling in
Okay.
the macula.
Mhm.
So we need to inject these anti-VEGFs into the eye, close to the retina,
Hmm.
close to the macula. It is injected inside. It's like it's a given through a very thin needle, so it doesn't cause any, like most people, oh my
The
god,
anxiety of
injection in the
injection.
eye,
Hmm.
that is scary. But it's not something that is very painful, because we use very, very fine needles, but it needs to be given. So these anti-VEGFs are one of the newer treatments that have come in. They have been there for some time, and they help in reducing the new blood vessels that have formed. So the new blood vessels shrink and the swelling automatically comes down. And as the swelling comes down, the vision improves. Whether that person will get complete vision back or not, again depends upon how early he reaches us. So
So
the earlier we catch the edema, the swelling, the better it is for reducing the swelling.
so it is better not to stop for the warning signs, and the at the first change or something different you feel in your vision, it is better and more better if you are going for the regular checkups.
Yes, prevention is always better than cure. So, and like I always tell my patients, after the age of 40, we all require reading numbers.
That's true.
So, somewhere God is telling you, go to a proper
Ophthalmologist.
doctor, get it checked.
That's true.
Okay. And this spectacle number that you get around the age of 40 goes on increasing every 1.5 to 2 years.
Mm-hmm.
So you need to keep changing those numbers. The number increases. It's an aging change. You can't prevent it.
Mm-hmm.
So it is a very good thing that it's our eyes are telling us, I need a checkup.
That's true.
Okay. So once a year, it is always good to get an eye checkup done along with your other, like if you're not diabetic, not hypertensive, don't have any other uh, problems which usually occur in older age group. Still, it is a good thing to get your all your blood tests done, like a lipid profile, renal profile, like to know what is your urea level, creatinine level, all those things like routine blood tests, as well as an eye checkup. It's a good thing to do for everybody, especially after the age of 40 or 50. You should get an eye checkup done.
So, accepting that the age is going to catch up and keeping up with the age and
Yes,
taking care can go a long way.
yes. And one very easy thing to do is do it in the month of your birthday.
That's a nice
Don't do it
idea.
on your birthday, but do it on in the month of your birthday, so you remember, okay, this month is the month when I'll get all my tests done, make sure that everything is fine. So that's one way of, making sure things are caught early.
Yeah, and it is the best gift we can give to ourselves.
Ourselves, absolutely, and our loved ones.
That's true. So, we have been talking about these injections. So, are there any other treatment options available for these degenerative changes?
For the dry kind of AMD, most often it is just antioxidants that we give. If it starts converting into a wet AMD, then we give injections, and these injections sometimes need to be given repeatedly. And that's what I said. The earlier we catch the swelling,
Mm-hmm.
the possibility of it reaching near normal are much higher, and the number of injections required also reduce. Plus, nowadays we have newer injections that have come in. Like sometimes we earlier in the when these injections just started, we used to give them every month.
Okay.
I've had one or two patients where I've had to be given almost 10, 12 injections
Mm-hmm.
every month,
Mm.
because the swelling goes up, you give the injection, it comes down, the action is for a month or so. The minute it's about a month, 3 weeks to a month, again the swelling starts, then again inject. So
Mm-hmm.
this is what used to happen, but now we have better drugs which we need to give that injection maybe once in 2 months or once in 3 months.
Okay. The
So
span
the
has increased.
penetration is better.
Mm-hmm.
It penetrates deeper into the retinal layers, and that is how it can act for a longer time.
Mm-hmm.
So these are some newer ones. They are a little more expensive, but they give better visual results also. So that is one. And the new thing that has come in, or in fact, it's not come in routinely, it's still in the experimental stages, that is gene therapy.
Okay.
Because again, macular degeneration is known to be genetic.
Mm-hmm.
So there are certain genes which are responsible. So what is being done is those particular genes are taken, and through a medium they are injected into the eye,
Mm-hmm.
same way as we give these
Injections.
injections inside, and it goes and hits that area of the retina, so that it reduces the swelling, takes care of the pathology. The
Mm-hmm.
genes go and
They may
uh,
repair it
yeah,
because we you are
somewhere there
introducing.
is a
Mm-hmm.
repair. So there is a lot of hope, and if this gene therapy really helps, then these repeated injections and all those things will come down, and visual prognosis also will be better, visual results will be better.
So when it comes to AMD, earlier we go, it will help. And also that follow up is also important because sometimes
Definitely.
the it can come back.
Yes, yes. And see, I can understand the psychology of a patient also, that how many times do I need to take these injections? Every time I need to keep coming, and not everyone can afford it. That's also a challenge. So, but having said that, what is necessary needs to be done. And today we do have injections where you don't need to take them every month. So
We
that
have to
is,
ultimately compare it with what we are losing.
yeah.
Losing
And
eyesight can be
yeah,
really
and my
detrimental.
advice would be, have a good diet, exercise well, okay? Maintain your health. If you have blood pressure, diabetes, any heart problem, make sure that it is treated and you take care of it well, so that all these other problems uh, definitely do reduce.
And when we are talking about these degenerative changes, is there any other effect which happens on the overall health or anything?
One of the things that is very recently being talked about, and we have seen it but probably not really understood it, is that when there is a vision loss, not only related to AMD, but there are so many conditions like glaucoma, diabetic retinopathy. These are certain, or optic nerve, the nerve itself gets
Damage
damaged,
sometimes.
maybe injury, maybe again age related. All these things, when the visual loss is significant, it is seen that there are also cognitive changes that occur, especially in the elderly.
Okay.
Cognitive changes, in the sense, what I mean is memory loss, ability to comprehend.
Mm-hmm.
These are certain things that are being seen and they are being evaluated nowadays. So, addressing visual problems somewhere also addresses these cognitive problems that we see in old age.
Mm-hmm.
The exact cause is not known, but what they say is, when you can't see something well,
Mm-hmm.
the brain is trying to focus onto that visual area, and that's why the other areas in the brain, like your memory or your ability to comprehend, these certain areas, they kind of get neglected a little.
Okay.
That's the theory. We don't know exactly.
Because we are also seeing a sharp rise in senile dementia and
Yes,
Alzheimer's
yes,
nowadays.
yes. So one of the cause could be that, is what is being said.
So,
So all our senses, visual senses, our hearing, as we age, these are the two things that get affected to a large extent, even in an otherwise normal
that's
person
true.
who's
Hmm.
non-diabetic, not
Hmm.
hypertensive, no heart disease, nothing. He's just old, he or she. So, hearing is a problem, vision is a problem. Then all these other things also start. That
Hmm.
is what is being said. So, this is one of, it's being talked about in a big way nowadays. And this is something that we need to
Explore more.
understand and know that some things like this happen. I
So,
will
are
give
they?
you an example.
Yeah.
A very senior eye surgeon,
Mm-hmm.
very renowned eye surgeon, um, in his 80s. Okay, we had seen very active person, who used to be in all conferences and
Mm-hmm.
everything, like, and everyone looks up to that person. And suddenly we had seen he had just started going into a shell.
Mm-hmm.
We wouldn't see him in conferences, we wouldn't see him talking, he wouldn't be around. And we realized, uh, because I know the family also, that he had had a hearing problem. Okay, so going to conferences, he couldn't talk to people. So then he started going into a shell. not wanting to meet people, because even if they are talking to him, he's
You
not
won't
able to,
understand and
yeah, there's
respond.
no communication. So he started going into a shell. And a few years later, we saw him bounce back. And the secret was he wore a hearing
Hearing
aid.
machine.
It was as simple as that. And that's where I feel these are certain senses. One sense goes down, everything starts going down.
That's true. That's so very true. I have a personal experience similar to that in my family. I have seen that. So
Yes.
I really I can relate to this what you are telling me. Ki sometimes just catching it at the right moment can make all the difference
Oh, yes,
when,
absolutely.
and especially when we are talking about our parents.
Yes,
So
yes, our parents definitely. Anybody at that age, we should be able to pick it up soon. And so, definitely, prevention better than cure. But today, we do have good medications, good treatment options by which these things can be taken care of, provided the people come to us early. In late stages, as we all know, not only eye related, any part of our body, anything that is
progressive.
pushed, saying it could be nothing, it could be nothing, that should not be done. Address the problem quickly, so then there are treatments.
The message is loud and clear. Okay, right information, right time. We have now
Yes,
the treatments available, so please consult at the right time.
yeah. And hopefully, gene therapy should come in quickly, and we'll be able to, like, say we are actually treating the problem and not just keeping it under control. That would be the difference.
That really gives us hope. Another problem, doctor, which is very common in this age group, is cataracts. So can you tell us about what exactly happens when we say that a person has a cataract?
So, like I told you, this is our eye, this is the cornea, and this is the lens.
Mm-hmm.
Okay, the rays of light are bending at these 2 points, the cornea and the lens, so that it forms a point focus here on the macula.
Okay.
Okay, and that's how we are able to see things very sharply,
Mm-hmm.
very clearly.
Mm-hmm.
Now, what is happening is, in a cataract, this lens, which is like the lens of a camera,
Mm-hmm.
it is helping us adjust, and we are able to see distant objects, near objects, intermediate distance, everything clearly is happening because of this lens.
Hmm.
Now, this lens starts getting cloudy,
Okay.
or there are like whitish areas coming inside the lens.
Mm-hmm.
Like if a camera, the lens of a camera has dots on it,
Mm-hmm.
or has dust on it, or internally some damage happens, then that lens cannot work properly.
Yeah, it won't give
It
the
will not
sharpness.
pass on the light
Mm-hmm.
clearly. So, same thing happens here.
Okay.
This lens starts getting cloudy, so it cannot bend the rays of light properly, and the light doesn't fall properly here.
Okay.
So, then there is decrease in vision. And this cataract, the lens becoming opaque, whitish, this goes on increasing. So, in the initial stages, this lens will have clear areas and slightly opaque areas,
Mm-hmm.
because of which the light gets scattered. So, very often in the early stages, patients come to us saying, I'm getting a glare.
Uh-huh.
When I
Like.
drive at night, I get a glare. I'm not able to see things clearly.
Mm-hmm.
Otherwise, in the daytime, I'm fine.
Mm-hmm.
That is the earliest sign of a cataract.
Okay.
Your vision is normal, but the night vision problems, glare problems, even bright sunlight, you get a glare, you are not able to keep
See.
your eyes open.
Mm-hmm.
So, this is because of the light scattering, and that is what happens. And slowly, all the lens fibers start getting more and more opaque. Like it is how we start graying.
Mm-hmm.
Initially, we have a few gray hair.
Right.
Then slowly, more and more starts graying. Then one day we reach a stage where all our hair is white. So similarly, the lens fibers, they get whitish or opaque, and one day is reached when the whole lens is completely white. That is a mature stage of cataract. At that stage, the person who has a mature cataract cannot see at all.
Okay. But then why it is said that the cataract has to mature before we do the treatment?
Um, well, that was a thing of the past,
Okay.
because in the past, maybe 50, 60 years back, there were no equipments as such.
Mm-hmm.
I remember the times in, my grandparents or his brothers and all, when they got operated for a cataract, it was done at home.
Okay.
The doctor would come home and do the cataract.
Mm-hmm.
There would be a one large incision, means
Mm-hmm.
like if you take the whole, like the center,
Mm-hmm.
the black part of your eye,
Mm-hmm.
180 degrees,
Okay.
there would be a cut,
Mm-hmm.
and the cataract would just be removed.
Mm-hmm.
Naked eye.
Okay.
Okay.
Mm.
And then there would be sand bags which would be put on the side, because the person cannot move.
Huh.
If he moves, then things from inside, because it's an open wound. So
Mm-hmm.
these that
That
was the
crude
thing of
was
the,
it?
yeah. But at that time they used to say wait till it becomes ripe. No
Mm-hmm.
longer, because we use what are called as operating microscopes,
Mm-hmm.
through which we visualize things. It's a magnified view, plus it also gives you a lot of clarity, like layer wise. So we are able to do a very good surgery, even when the cataract is not ripe. In fact, we tell our patients, don't wait till it becomes ripe or mature.
Because they will lose the vision also.
They lose vision. Plus, of course, once we remove the cataract, even after it has become in a mature stage, and if the retina and everything is normal, they will regain full vision.
Okay.
But the cataract has become hard.
Mm-hmm.
Okay, as those lens fibers start becoming opaque, they become hard.
Mm-hmm.
So to remove the cataract, today we do what is called as phacoemulsification.
Mm.
We use a machine by which we are removing the cataract through a very small incision. It's hardly 2 millimeters,
Okay.
not centimeter. It's
Mm-hmm.
2 millimeter.
Mm-hmm.
So we go in, we emulsify the cataract. That means that cataract is broken into smaller and smaller pieces. It's like a cake.
Mm-hmm.
You make
Thin
pie,
slices.
yeah,
Mm.
pie shaped
Mm-hmm.
wedges out
Mm.
of it, right?
Mm-hmm.
So this whole round cataract which is there, it we makes like 8 pieces out of it,
Mm-hmm.
and then each piece is sucked out
Mm-hmm.
through that machine itself, and the cataract is removed. And we also put in an artificial lens. That lens goes inside and stays inside forever.
Okay.
That lens will stay there till that person lives. So it is very important that people do not have this notion any longer that it has to become ripe. No, we tell our patients don't wait, because the harder the cataract gets, it is more difficult to
To
break. You need more, we use ultrasonic energy. So it needs more force,
more
more
the force,
energy.
more the
Then,
damage it can
yes, it
happen.
can cause damage. And that's why you should never wait. And why wait till you go blind?
Exactly. That is such a bad
It's
feeling.
not
So,
required.
very important message there, because
Yes,
that is the common myth which is there, that we have to wait till the cataract is ripe.
yes,
Still, that is
yes.
predominant in the general population.
And
So,
another myth that we very commonly encounter is that cataract can be dissolved with drops.
mhm.
There have been so many instances in the past where there have been people who have come saying that, and and there have been many, like, people going in lakhs to some
Baba.
baba or something, who put some drops and the cataract is, it vanishes. Things like that don't happen in our normal lives, and there are no drugs that can make a cataract dissolve or just
Vanish the.
disintegrate or
Mm-hmm.
vanish or whatever. There's no such thing. It's a, like I said, it's an aging change. Just like our hair is gray with age, all we can do is color our hair, dye our hair to make it black.
Mm-hmm.
But the new roots that come out are always
Why?
gray. You cannot reverse that.
Mm-hmm.
So, similarly, in a cataract, you cannot reverse those opaque fibers to clear fibers.
And that's why a new lens is required, maybe.
Yeah, that's why an artificial lens is put in,
Mm-hmm.
so that the people can see very clearly. And today we have so many new technologies coming in,
Mm-hmm.
by which removal of cataract has become very simple for a patient. In the sense, there is no admission required. You don't have to stay in the hospital. You maximum in an hour or two the patient goes home.
Mm-hmm.
There is no injection given, no anesthesia. Anesthesia is there, but in the form of drops. We put anesthetic drop, and since the incision is so small, the wound size is so small, we can do it by just asking the patient look at the microscope light, and the
Okay.
surgery is over in maybe 6 7 minutes, maybe 10 minutes. That's
Wow, that
about
is
it.
so wonderful,
Yeah,
because I remember the even the recovery period and
nothing,
this precautions were so many. Just
nothing.
10-15 years back when they used to do it. So the with the latest technology, it is just a OPD procedure.
It is not an OPD procedure. It is definitely the person needs to go into the operation theater.
Of course.
Uh, but, but he walks into the theater, walks out, no stretcher, no wheelchair, nothing, nothing, and just walks out of the hospital also. Most of our patients, they go to work the very next day. Women can cook. We just give protective glasses so that there should be no dust going inside. We just need to take care of infections. And even infections in the eye have come down to a large extent, also because again your wound size is so small and it is so airtight
There is
that
no open wound.
it's not open, so it's so airtight that nothing can go in, not even bacteria, virus, nothing.
Yes.
So the chances
But
of
any
infections are very.
precautions?
Yes, one thing that we tell all our patients is don't go in dusty and crowded areas for at least about 8 10 days. Other than that, there is no restriction whatsoever.
Okay.
All our patients, they go to work, they do everything. So there is really no restriction. It's become very easy for the patients. And then why wait till it becomes right when it
Exactly.
has become such an easy procedure for our patients? They can literally, like, no need of leaves, nothing is required. Only thing is, today sometimes we even do both eyes simultaneously.
Mm-hmm.
We do one eye, same time we do the other eye.
Okay.
But by and large, we don't like to do it because any small little problem, both eyes should not get affected.
At least one eye vision is
Yeah.
there.
So if you ask me, my personal opinion, I never do both eyes same time. I do one eye, I leave a gap of at least, even if sometimes patients are coming from out of town or something, then we wait for at least one day,
Okay.
and the third day we do the other eye,
Mm-hmm.
but never same day both eyes.
So again, to cataract, another important message there: you need not wait. It is a
Yes.
very, it has become a very easy procedure for the patient because of the technology.
Yeah, and also the lenses that have come in, the technology is such today that you can get rid of, means you can see distance, intermediate, as well as near. You don't need to wear glasses at all. Today you and I are wearing glasses
That's true.
because of our near
Near.
vision
Mm-hmm.
mainly.
Mm-hmm.
So those lenses which go in can take care of distance and near also. So if a patient need not wear glasses at all.
So the
So we
lens.
have come to that.
So the lens we are putting is as good as what God has given us.
Yes. So I always tell my patients, if you're 60 years old, you'll see like when you did when you were 16 years old.
Oh. At least one thing we can go back in time.
Yeah,
Nice.
absolutely.
Another most feared, I'll say, a condition where there is a lot of fear regarding the loss of eyesight is glaucoma. So, doctor, can you tell us about what is this glaucoma and what exactly happens?
Well, glaucoma is something like a blood pressure in the eye.
Okay.
To put it in a very simple manner, that just like people have blood pressure, they take tablets, medicines, and make sure that the blood pressures are under control.
Mm-hmm.
So, in the eye, now our eyeball is round. Okay, it's not soft; it is firm
Mm-hmm.
because there is a fluid inside the eye which is keeping our eye firm. Okay, now when the pressures of the eye increase, normal pressure is 10 to 20 millimeters of mercury.
Mm-hmm.
Okay, when this pressure increases, now what is happening is it starts pressing on the optic nerve,
Okay.
and the optic nerve starts getting damaged. Damaged in the sense there are blood vessels inside the nerve, they get compressed. So that nerve starts becoming what we call as pale, or the blood supply inside that nerve goes down. So it can no longer carry the impulses or the visual knowledge which is coming from the eye. It can't transmit it properly to the brain.
Okay.
And that is why glaucoma is something which is really feared, like you said. We call it the silent thief of sight.
Okay.
Why silent? Because a person never realizes that there is something going on inside,
Okay.
because it's a gradual change.
And it can lead to
And
loss of
the
eyesight?
vision remains normal, the central vision
Uh-huh.
remains normal till the last stages. It is the peripheral vision which starts coming down. What I mean by peripheral vision is when we are driving,
Hmm.
we are looking straight,
Hmm.
but we realize some scooter is coming from the side, some rickshaw is coming from here. There
Mm-hmm.
is some person who is probably wanting to cross the road. We are not looking at that person, but
Surrounding
you
perception.
realize that there
Mm-hmm.
is something coming close to your vehicle or whatever. That is peripheral vision. So although you are not looking there, you are able to see movement, you are able to know there's something here, you know. So that is what gets affected. And because it's the peripheral vision, people who are driving long distances, people who are active, they may realize it, that
Mm-hmm.
oh, there's something came by, I didn't realize that it was coming close to my vehicle. But even drivers sometimes don't
Miss it.
realize it
Mm-hmm.
because it's so gradual that you may not come to know about it. So again here, after the age of 40, because again glaucoma most commonly is affecting the older age group. So after 40, it's a good practice to get your eyes checked, not just the spectacle numbers, but your eye pressures and your retina
Okay.
needs to be checked once a year.
So, are there any different tests how
Yes.
it is done?
So like I told you, one of them being what we call as an open angle glaucoma.
Mm-hmm.
Now explaining those things becomes a little difficult, but um, this type of glaucoma is the silent one,
Okay.
where gradually vision comes down. Again, most often our patients think it may be a spectacle number or it may be a cataract.
Mm-hmm.
Okay,
Because the age
and
is.
it's the same age. It's
Mm-hmm.
the same age, and not to blame them because they don't know. A lot of people are not aware that there's something like pressure of the eye, you know.
Yeah.
So it becomes important that we build this awareness. And I'm very happy that you are conducting these kind of uh, these podcasts so that people are aware of these things. It's very sad to tell any patient that you are almost blind and I can't do anything for you. It's
Yeah.
very sad. So it's always better, once we have again picked up the glaucoma, we realize that we have instruments by which we check the pressure of the eye. And once we know that the pressure is high, or we see that the optic nerve is getting damaged, then we have a few more tests that we do. We have computerized tests to know what is the exact extent of damage, like
Mm-hmm.
what is exactly is the peripheral vision of this particular patient, of this particular eye.
Okay.
And that's how we do those tests and see what exactly is the damage, and depending on that we do the treatments.
So, what
The
are the
other
treatments?
glaucoma that is there is
Hmm.
not so silent,
Okay.
in the sense that we call it the narrow angle glaucoma. There are episodes of high pressures that happen
Mm-hmm.
uh, at certain times. Most often it is in the twilight zone. Twilight zone meaning it's not completely dark,
Uh-huh.
like say around 6:30 in the
Golden
evenings.
hour, the
Yes, so something like that, because the pupil gets slightly dilated at that time inside, and it can cause a little, the space inside reduces, and it shows up as a sudden spike of high pressure. So a
Okay.
patient may have headache, may have eye pain, and if that episode continues, it's an acute attack. The patient has severe headache and vomiting
Okay.
because of the pressure inside the eye, which has suddenly shot up, and it has shot up to a stage where it can't come down. So then it's a medical emergency, but those are rare. The more common one is the silent one,
Okay.
unfortunately.
Mm-hmm. So, what
So,
is the treatment if we?
so in the initial stages, we just give eye drops by which we reduce the pressure. Like how blood pressure patients, they take tablets and keep their pressures under control.
Mm-hmm.
So similarly, we give eye drops to reduce the pressure. If the pressures are very high, sometimes we have patients who come to us with 40 pressures,
Mm-hmm.
which are double of the normal. Then we give a certain tablet, which is called as a Diamox tablet, to reduce the pressure immediately,
Mm-hmm.
because the higher the pressure and the longer that pressure is in the eye, that much pressure it is putting on the optic nerve. So we need to release that so that the optic nerve remains as healthy as possible. So we do give tablets, but these tablets do have some side effects. We have patients complaining of tingling, numbness with those tablets and all that. It does cause a lot of reduction in potassium levels,
Okay.
and that can sometimes be dangerous, especially in the older age group.
Mm-hmm.
So that is why, as far as possible, we should avoid tablets unless it's absolutely necessary. Then we do give for some time, but we can't give it like
For a
forever.
longer period.
No. So drops are what are given, and we have seen sometimes there are different types of drops which act at different levels inside the eye. So sometimes we put patients on 4 types of drops uh, in the eye. And of
Mm-hmm.
course, today again, because of newer medications and all coming up, good amount of research having been done, um, these eye drops not only bring down the pressure, they also are neuroprotective. That means they protect the optic nerve.
Okay.
So they are good drops, and even the frequency we need to put just once a day or twice a day. So it's not so bothersome to a patient, but provided again it is picked up early.
So everywhere we are coming back to the same point.
Yes, picking up things early is what is required. And sometimes, if now we see some patients, they cannot put the drops. Aging change again, memory loss, they don't remember. Then we also have surgeries. We do a surgery which is called as a trabeculectomy, whereby we can reduce the eye pressures by doing surgeries. Then the need for eye drops and all reduces. But that is only done in patients where it is absolutely required.
Is it again a laser based surgery or something?
There are lasers, but this particular surgery is not really laser, and it is the gold standard surgery that is done. It just creates another channel
Okay.
for the that, like I told you, that fluid is getting collected, it's not passing out properly, because of which the pressure is building up. So we make another channel for it to flow out, so the
Simple
eye
physics.
pressures reduce.
Mhm. So space is created to reduce the
Yes,
pressure.
yes.
Is it anywhere related to the blood pressure? Is there any
It
risk factors for
Yes,
glaucoma?
yes. The risk factors, one is again genetic predisposition. It is quite strong. So we tell our patients that if one person has glaucoma, you have to tell your children who are above the age of 40 to get it examined, your siblings
Hmm.
around that age to get it examined, because there is a very high genetic predisposition, and it is known to run in families. That is one. Family history is important. The second thing is blood pressure and diabetes also, because it is the ocular blood flow. With your blood pressures increasing, even the blood vessels inside the brain and all are affected. So those blood vessels from the brain are going into the eye and the optic nerve.
Mhm.
So there is a correlation.
Okay.
But not that every person who has a high blood pressure will end up with glaucoma.
Okay.
No. But diabetes and blood pressure are known to have,
They are the known risk
yeah,
factors.
they are the known risk factors. And age itself is a risk factor.
Yeah. One is not in our control, other two are in our
Yes,
control. So we can work on what we can control.
absolutely. So the message I would give to everybody, like again and again, we are coming to the same thing. Everyone after the age of 40, they have to get their eyes checked. And most often today, most of our patients, most of us, we go to the opticians and get our spectacle numbers.
Mhm.
That's okay, but getting your eyes examined, not just spectacle numbers, your eye pressures and your retina once a year after the age of 40 is a very good principle to follow. It's it's going, anything that is detected early, your vision can be preserved to the very end. But the same thing, if it is late stages, nothing can be done. Unfortunately, nothing can be done. That is the reason why this thing, I'm very happy that you are doing this, so that it brings about awareness that reaching the hospital or reaching your eye doctor early is something that will help preserve vision till the very, very end.
Right, doctor. It is so very important. Sometimes we have solutions for the problems, and we feel bad because the patients are not reaching us,
Yes,
and we
yes,
are not able to help them because of that.
yes. I think we had a conversation about the foundations that, where we do charitable activities. One very good thing is to reach people. So, especially the rural populations, because they really don't know much. So, reaching there, catching them early, treating them is something which helps us preserve everybody's, most people's vision till the very end. So, early detection, early treatment.
Thank you, Dr. Shilpa, for that insight into the eye problems of the elderly. I definitely feel we have a hope with the latest technology and
Yes.
awareness. We can help a lot of people to preserve their vision till the end.
Yes, absolutely. I think it's a very, very important message that I would like to give. After the age of 40, once a year, a visit to your eye specialist is very, very important.
Thank you for tuning in today's episode. See to the fullest. I hope you have deeper understanding into the risks and the symptoms and the latest treatment options available for the eye problems for elderly. So, till the next time, stay healthy, stay informed. Thank you.